Our first panel for today is Protecting Tomorrow, Women and Children of War. So we'd like to invite Dr. Christina DUZYI from MGH Department of OBGYN, Dr. A.K. GOODMAN from MGH Department of Obstetrics and Gynecology, and Dr. LIDIA BOROSOVA. She will be appearing pre-recorded. So please. Yes.
1 minute. It's just me. That's only you? Yeah. They're all, I have recordings of all of them. Recordings? Yeah. Okay. That's fine. That's great. Yeah, thank you. Well, while we get the tech going, good morning, everyone. My name is Christina DUZYI. I am Ukrainian American, so good morning, and I apologize for missing yesterday. I was seeing patients in New Hampshire, but following all day long. I am a maternal fetal medicine physician at Massachusetts General Hospital. I'm the medical director for labor and delivery, as well as the maternity units. I run the maternal fetal medicine fellowship, and I am the director of the complex obstetric surgical program. And so thank you all for coming. It's nice to meet you today. A panel of one, but not exactly. So the format for our presentation is slightly different. I think you'll see as we get going. Hopefully, no problem.
Also, while they're getting that set, one of the people that Christina will highlight is an obstetrician from Lviv. Yesterday, whoever was here yesterday saw Dr. Frodel show a cemetery that's stationed in Lviv for soldiers. That unfortunately keeps growing and growing. Where it's juxtaposed is directly across from the maternal fetal hospital where Lydia works. And she talks of it. She doesn't say it in the clip, but she does talk when you talk one-on-one with her about sort of looking out on the gravestone. And she's literally bringing life into the world every day, which is what's going to sustain the country and the culture. So it's very touching when she talks about it. But, yeah.
Perfect. Thank you so much. And I just want to say how difficult it is to follow Dr. Redlener. Thank you so much for your talk this morning. Okay. I want to start here. I think that every person probably in the world saw this photo when this came out at the beginning of the war as one of the first examples of how civilians were being impacted by the full-scale invasion. And as a maternal fetal medicine specialist, this was really a call to action for me, that war is not simply something, as we've heard already this morning, that happens on a front line. This has impacted the lives of mothers across Ukraine. And so my charge today is to sort of pivot a bit towards talking from what's happening on the front line to what is happening within mothers and families within Ukraine. And so a segue from the previous conversation. This, as most Ukrainian Americans who grew up here, felt a charge for, what can we do? What can we do now to be helpful? This is 21-year-old me. This photo on the left here was taken at Volynska Dитяча обласна лікарня. This mother doesn't actually know that she changed my life, but I was actually there with the intention of becoming a pediatrician. I learned many things on that trip. Number one, many children in NICUs in Ukraine are nimbuchtan. Number two, for anyone who doesn't know what that means, it's God-given, so many children are nimbuchtan. Number two, that physicians in Ukraine are technically brilliant and among the most innovative in poor resource settings of anybody I'd ever met. I had a pediatric surgeon say to me once, you go learn everything in the United States and then you come here to learn real doctoring. And that was really impactful to me and I think is so true today. And the third is that I was more drawn to her story. So this mother was exactly the same age as me. This was her third preterm birth and nobody had ever explained to her why that was happening. And I was more drawn to her story than the child, and so that is why I'm an obstetrician today. So on the right, this is Vadim Vus. He is one of the first scholars at risk that came, and he is actually a family medicine physician from Rivne. He is an ultrasound specialist, And I thought to myself, well, what can I show an ultrasound specialist? Nella will tell you that I can do many things, but fundraising is the thing I'm absolutely worst at. I said, I can't get this man ultrasound machines. I am terrible at that kind of thing. And I thought, well, how can I be helpful to this person? Maybe I'll show him around the labor and delivery unit. I'll show him how we use ultrasound in obstetric care. The really interesting thing that Vadim taught me was that what he wanted was this. So when he left his trip, this is our multidisciplinary script for when we do safety rounds and go room to room and give everybody a voice. And what he asked for at the end of the trip was a way to have every member of a team feel like they had a voice. And that was so impactful to me because the thing, that was side to me. That wasn't something that I thought was going to be the thing that he was going to take home with him. And it really showed me that you can't know in advance the thing that's going to change somebody or the thing that will be helpful to somebody else. And that gave me a little bit of confidence to move on to what we did next. So this really brought an opportunity, and I have to credit Jackie and Nelia for really having a vision that mothers are part of the story in Ukraine, for us to bring a cohort of OBGYN physicians from Ukraine to Mass General. So we crafted a curriculum, and I wanted this to not be just sort of like somebody shadowing me for a month, but to be really expansive. And so we approached the department, and we got buy-in from the entirety of the department. We had more than 30 members of the department, as well as experts in cardiology, neonatology, anesthesia, critical care, and most importantly, psychiatry, to really say, we want this to be as robust an experience as possible. And I will forever be grateful to all of the members of my department who dove right in on that. You know, Ukrainian Americans have a certain oomph for wanting to do that, but everybody else just felt like it was the right thing to do, to provide some foundation for people who are here just to seek help and to learn new things. And so we went through this process. We interviewed our candidates. We, with much ado, had visas obtained. Increasingly difficult because of concerns for people not wanting to come back or concerns for men needing to stay in Ukraine. But the three that came, so VOLODYMYR ARTYMENKO was at the top. He was interested in obstetrics, the impact of microbiome on adverse pregnancy outcomes, and most especially fertility management. What he said in his interview and has said repeatedly since is the birth rate in Ukraine is going down. The fertility rate in Ukraine is going down. People aren't having children as much, but also they're having increasing adverse pregnancy outcomes. There's more miscarriage, there's more preterm birth. The children aren't surviving through birth. And so he wanted to focus on that. Natalia Nasradina is interested in cervical pathology. She was really more interested in GYN, pelvic reconstruction, and women's care. And Lida was really interested in labor floor management and also fetal surgery. So we actually were able to get her a day with our counterparts in fetal surgery at Boston Children's Hospital, which was really a fantastic day for her. So we're going to start the panel with some interviews. So this is Lida's interview. I hope there's audio. No audio. Right.
Lydia, thank you so much for joining us today. I'm so pleased to get the opportunity to talk with you and to share your experience with the audience today. I wonder if we could start just by you giving us an introduction of yourself.
Hello, I'm Lydia Borosova. I'm OBGYN doctor in the First Medical Union of Lviv. It's the biggest hospital in Ukraine.
I give you so much credit for all the work you do in that hospital, and I really enjoyed getting to hear about the work that you do there and to compare it when you were here with us in the United States. I wonder, when you heard about the opportunity to come to Boston, what made you decide to do it?
When I first heard about the opportunity to come to the United States, especially to Harvard Medical School, I honestly couldn't believe it. At first I thought, it's really possible, and then I thought, it's amazing. I might actually see how one of the best medical schools in the world works. I wasn't afraid of anything, not the long trip, not the language, not even traveling alone and being away from my family for a while. I just really wanted to be an environment where medicine is always growing, where doctors learn from each other and use the newest approaches to care for patients. I knew this kind of opportunity might come only once a lifetime, so I hoped everything would work out and that I could become part of this program.
Well, Lydia, we're so happy that you did. You know, I think it was a pleasure for me too to get to learn as much from you as you learned from us and about your amazing care in Lviv. So, you know, one of the things that really struck me is that you're somebody who has such a clear vision for how these types of collaborations could work in the future. I wonder if you could share some of that vision with us.
Yes, I see great potential for future cooperation. Let's turn a long-term partnership between hospitals. I believe one of the best ways to continue this collaboration is through multidisciplinary team exchanges. Instead of sending only individual doctor for training, it would be even more effective to send wild terms from one hospital. For example, an OBG, anesthesiologist, midwife, neonatologist, and infection control specialist. After returning home, such a team can identify the main priorities for improvement, start putting them into practice, and build a culture of teamwork and shared responsibility. In our hospital, we already have this kind of experience. We collaborate with colleagues from a clinic in New York City that uses a multidisciplinary approach in rehabilitation. We have an active communication group and regular Zoom meeting every week to discuss complex cases together. The kind of teamwork turns knowledge into real action and helps avoid isolated efforts, creating strong and lasting results.
Yeah, I absolutely agree. I think, you know, I think the movement towards group work together, multidisciplinary work together is really great. And certainly continuous education, being able to discuss complex cases over time together really helps to sort of optimize as you move forward. I love that. And Lydia, one of the things that I loved so much was your commitment to setting a foundational support for the future of Ukraine. So I wonder if you have suggestions for how the program could build more foundational support for the future of maternity health in Ukraine.
I think the program can help stretch maternity health in Ukraine by creating long-term mentorship between Ukraine and US specialists, developing shared clinical protocols and quality standards, supporting pilot projects in maternity hospital to apply evidence-based messaging, and organizing regional education hubs where trained teams can teach others and share their experience. Modern medicine needs unity of standards, and when we share knowledge, build trust, and work together, we can truly make a difference for mother and newborns, because mother's health is the foundation of the nation's health future.
Oh, Lydia, I love that. That's so beautifully put. Thank you for sharing your experience with us, for sharing your opinions and your experience. I really look forward to continuing to work together in the future.
Thank you so much. Thank you so much for your support.
Oh, thank you, Lydia. We'll talk soon. Bye-bye.
Yes. Bye-bye.
Lydia was super cute. She was very nervous to do that interview. All right, how can I? She's great, right? All right. So this is then the curriculum that we built, and what I want people to notice is that not any individual piece of it, but just the breadth of the people who really contributed their time and expertise. I want to highlight a couple of key individuals. So Nandita Scott, up in the right corner, is a cardiologist at Mass General Hospital with an interest in women's health. She was really the person who actually brought the Scholars at Risk program into the Department of OBGYN, and then was willing to teach cardio-obstetrics, which I thought was really fascinating. Milena Weinstein in the middle is a pelvic reconstructive surgeon who herself is from a Baltic state, and so she very apologetically said, I can speak Russian but not Ukrainian, but I think that might help. And so actually it was fantastic, because the individual experiences in the OR were much enriched by the fact that she was willing to both share and communicate. And then A.K. Goodman, we have an interview with her in just a minute, but she's a GYN oncologist who is also a worldwide expert in obstetric violence. And so her talk will come in just a second. And what we wanted to do, in addition to sort of built-in robust clinical experiences, was to have a series of special conferences with special topics that were pre-solicited. So epidemiologic research. I think we heard yesterday, the statistics are sort of held a bit by the Ukrainian government, that we can't actually know things like preterm birth rates and fertility rates and fecundity rates. And so how do you conduct epidemiologic research? How do you get a good denominator in order to do your research? That was a conference we held. We had an entire session on management of perinatal PTSD. So Dr. Sharon Erisman and Dr. Darko Holoka, who are a husband-wife team who are experts in management of PTSD, gave us a conference. Maternal psychiatric management, I think Dr. Tesler spoke yesterday, giving us sort of optimal management strategies for both anxiety and pregnancy and postpartum depression. And then maternal support in the setting of gender-based violence with Dr. GOODMAN. So here is our next panel. Let me see.
Thank you so much for joining us today. I'm from faraway South Africa. I so appreciate you being willing to be a participant in our conversation. I wonder if you could give the group a little bit of just a short bio of kind of who you are and what you do.
Sure. Well, I'm a gynecologic oncologist, take care of women with cancer. And in the context of your conference, I've been working mostly in Boston, but I have two jobs when I'm not in Boston. One is working on infrastructure development for cancer care for women. And then the other is for, oh my goodness, almost close to 25 years, I've been doing disaster work. And both of those end up taking care of women in different ways. Mostly in my infrastructure work, I work in Bangladesh. And in terms of disasters, I'm on the federal disaster team, I'm on the regional disaster team, and on the Mass General disaster team. And in that context, get deployed into spaces where there's been some catastrophic change to society. And going in there, there's work to do with women who are pregnant, who are injured, sexual violence issues. And I even see people who have cancer that then doesn't get treated because they're in an austere environment.
Yeah. I mean, really, your work has been so inspirational. Longitudinally, I'm so happy that we've had such a good collaboration over time. And really, with your projects with collaborators around the world, I wonder if you could reflect for us what you think makes for a successful international collaboration.
Ultimately, it's friendship and love. You get called in, and then as an outsider, really, it's about respecting the space that you're in. And I've seen, and that sounds so obvious, but I've seen, and perhaps I've done it myself. I've gotten older and wiser and, learned from my mistakes, but also actually by observing other people, where people will go in and tell people what to do, where they don't really understand what's going on. They're seeing it and interpreting it through their Western non-disaster eyes and coming up with very wrong interpretations of what it is they're seeing. So just to allow people to teach you what's really going on allows collaboration.
Yeah, I love that. And one of the comments that you made that stuck with me in some of our collaborative meetings with our Ukrainian colleagues after the initial sort of visit that they gave, we've continued to have collaborations in 2-week intervals for over a year now, which is really remarkable. And one of the things that you reflected to me was that those meetings needed to continue at short intervals, not necessarily because of the amount of content, but as sort of therapeutic support for our colleagues in the war scenario. As we've built our programs together, how did you view the collaborations in the context of war?
Well, again, thinking about it from the disaster point of view, you're talking to people and you're working with people who have had a shift that developed such insecurity in their lives. I mean, there's this part of it where, and this goes unstated, where you don't know if you're going to be alive. And at the same time, what I've noticed is that people are very kind of dry-eyed about it. They're just kind of going about their business, getting up, going to work, saying, I got this project to do, it's so cool, I want to do this work. And then every now and then it's like, oh yeah, we had terrible bombing last night. And you're thinking, oh my goodness, you're here and you might not have been here. And how it's just poignant. And so I think what I was saying in the context of Ukraine and our 2-week conversations is I feel it's part of what we can do is to bear witness and be present and to, even if we don't really have anything to say about the particular work that we're doing, is to check in. So it's our check-in with them.
I love that. And I think that's so important. I've learned so much from you about those check-ins and the import of those check-ins and just really listening and being present. And as we support our Ukrainian colleagues in their care of women, so in sort of that angle that you've spent so much of your life working through, how do you view the goals of the Strength and Serenity Project and how we can use that as leverage to sort of help continue care for women in Ukraine?
Great. Well, the Strength and Serenity vision is about educating and collaborating to understand and to change the whole issue around sexual violence and gender-based violence. And clearly, anyone can have violence done to them, but there's a special focus when it comes to women. And that can be intimate partner violence, it can be violence done as a weapon of war, in a sort of sexual assault, and it can be done by ourselves providing care where we're doing violence by not having respect, by not allowing informed consent. And the one place that we've been working on this is this concept of respectful maternity care. The WHO has called this obstetrical violence, and that term was coined in South America around really inappropriate care, not necessarily intentionally inappropriate, but inappropriate care in terms of respecting women who are pregnant in labor and so forth, and that leading to terrible trauma. So that comes up in Ukraine in terms of whatever the baseline structure is in the medical system taking care of women who are pregnant, but then the context of that stress under war.
Well, AK, I feel like I could talk to you for a really long time about these concepts because you're such a visionary in terms of what we can do to continue to maintain support. So I just want to thank you for your time, for your commitment to our partners in Ukraine, for joining us from South Africa, and just thanks so much for all of your insight. Appreciate it.
She's a powerhouse. And so as a result of this collaboration, we've had a series of additional sort of ongoing projects. Our scholars have now left about a year and 9 months ago. We recently published in the Lancet OBGYN and Women's Health, Supporting Maternity Infrastructure in Ukraine, sort of thinking about additional psychological services. How do we protect maternity corridors? How do we support the Ukrainian population in the setting of supporting the birth rate? We are far below the replacement birth rate in Ukraine, and the future population really depends on being able to support maternity care now, as well as thinking about respectful maternity care. And our last panelist is VOLODYMYR. Let's see, one more. Our speaker, VOLODYMYR Artymenko, coming to us from Odessa. VOLODYMYR, could you do us a favor and give us a little bit about who you are and a little bit of your biography for us?
Yeah. Good morning, afternoon, or evening, ladies and gentlemen. It's my pleasure to be present here. I'm a full professor of obstetrics and gynecology in Odessa National Medical University. I'm senior physician at the maternity hospital, city of Odessa. Number 5, and for 3 years I was serving as the expert in the Ministry of Health of the Ukraine for the obstetrics and gynecology. So, and fortunately I'm now running a lot of things concerning education of residents and postdocs in my university clinic and maternity hospital, definitely Odessa National Medical University, a lot of the scientific research work in collaboration with my international colleagues and partners.
And Voldemir, you have described so many unimaginable circumstances to us. You know, you've shown us the way that your deliveries work. You've demonstrated sort of your delivery scenarios in bomb shelters. You were just telling me about your travel to local villages. You've really worked on behalf of your patients in unimaginable circumstances. How have you, additionally, beyond that, found time to prioritize your interactions with the HUG program?
Oh, so it's a very interesting question, so difficult. So maybe this is from my teachers, my professors who already passed, but consider as much as you are working, the more things you like, the more time you have to continue and to go forward. So that's why I just putting all these goals for the continuing collaboration with all brilliant colleagues from the Massachusetts General Hospital, from Harvard Medical School, after this Scholars at Risk program when I have been present, and so some of them have been really became my friends, not only like colleagues, and that's inspiring me that we are going forward because my patients and my colleagues could benefit from all of that.
That's fantastic, Voldemir, and I consider us friends, so I hope that I'm part of that cohort for you.
Yeah.
And part of the reason that I wanted to talk and interview for this conference is that I really think that our ongoing collaboration after your time in Boston has been a really interesting aspect. So your continuing work with the Harvard Strength and Serenity program has really been a longer-term program success. Do you have other suggestions for programs to be able to maintain longitudinal partnerships after the initial meeting?
Yeah. For sure, for the collaboration with the institutions you mentioned already, we have very tight connections and working together for the respective maternity care, especially in the time of war and crisis, and for the cervical cancer screening programs for Ukraine. And we really have very good results already, and we have even several in a row papers published, even one commentary in the Lancet of OBGYN, just launched journal, and the Journal of Perinatal Medicine, it's on the way already, after revising, and we have plenty of posters and oral presentations and lectures which were performed on the very high level, not only Ukrainian, but also high-level European and world platforms, congresses, workshops, and symposiums. So for the future, definitely it will have the possibility of continuing funding for this, because this is the most important thing. Unfortunately, not only our wills, our time, our inspiration, but also it's need funding to continue. Definitely one of the major goals today for my country, as I consider, is to perform the core team of national trainers, especially in the perinatal medicine field, which is very, very important today for the Ukraine. And that the whole country will benefit from that, because we will have the team of people who are devoted for their job, who would like to continue despite all the circumstances, to go not only for the scientific research work, which is very, very hard for now, unfortunately, but also to have the mostly benefit for our patients.
Voldemir, that's really, I agree. It's so inspirational. And I think you and I have had such long conversations around what a day of training could look like and what resources we could build for Ukraine together. And I wonder how you think, kind of as our last question, the role of the HUG program to continue to support those types of collaborations so that more on the ground education can happen over time. What do you think that could look like in the future?
I think it's the best option is the hybrid program. After my experience, not only being here, but before as running simulation center and be chef of the department, for the 4 years in a row, and to have this first academic center for the whole my country, starting from 2013 to 2017. So it's need to be the hybrid format with their immersive like simulation classes with the scheduling and the clinics like 24/7, plus definitely lectures of your brilliant speakers and professors which we have like in your cohort. So, and for that reason, to cover like fields like emergency in obstetrics, like infections in obstetrics, like some special hands-on trainings. So if we will have the possibility to train the national team, and then these people going for their parts of the country, they could spread their experience under your umbrella, and a lot of our colleagues, doctors who are working on the ground will benefit from them, because just online things, due to the COVID and due to the war, these online things, they're not useless, but it's very, very difficult to do something and to listen to even Nobel Prize laureate when you have sirens, bombing, explosions, 24/7, you don't have like normal sleep, and you need to be very strong in front of your patients and even in front of your family, because they rely on you and they want you to help them, even if they will not care what condition you are in. So that is very, very important. And I hope that the people who are trying to help us, they will understand that only thing to do like brilliant lectures, it's really insufficient, because people are thinking how to survive, and that is the most thing what we could produce, just to transfer the skills and knowledge exactly on the ground. That is my idea.
Well, Volodymyr, you've been such an inspiration in terms of the amount of energy you've devoted on behalf of your patients, your family, your country. I'm looking forward to sort of ongoing collaborations over time. Thank you so much for your time and for sharing your experience with us. We really appreciate it, and look forward to continuing to work together in the future.
Yeah, thank you so much. Slava Ukraini.
Heroям slava.
Okay, so thank you all for tolerating sort of an interesting format there. But I think, you can see, evidently I only have 3 things that I say, so I'm sorry about you watching my interview techniques. I really think observation and education are foundational towards development of long-term partnerships, but the speaker yesterday that's now been referenced 3 times who said, you can't graduate without knowing how to intubate as an anesthesiologist, you can't graduate as an obstetrician without knowing how to hands-on deliver a baby, right? And so, observation and education are foundational, but there must be more. You also need large-scale institutional departmental buy-in for faculty that are beyond Ukrainians. So I think, all of us who have our individual ties can start the work, but you really need more people to be brought in to have meaningful and globally impactful work. OBGYN care is foundational and not peripheral to wartime support. The future of Ukraine is in the wombs of these mothers, and we really have to support them. And then it's critical for Ukraine's future. So thank you for your time.